welcome to the Global Voice on CFCR 90.5 FM. My name is Mackenzie, and I'm your host for today. The Global Voice is a radio show hosted and produced by Saskatoon Open Door Society and Saskatchewan Association of Immigration, Settlement, and Integration Agencies, also known as SAISA, and it celebrates diversity and inclusion. It is about our community and the many voices that make us unique. The show features stories and conversations about ordinary people doing extraordinary things. The Global Voice is about you and me and all of us that call Saskatoon home. The Global Voice on CFCR is brought to you by Weens Insurance Group. If you have questions about insurance for yourself, your family, your home, or your business, then Weens Insurance can help. Call Weens Insurance at 306-934-7309 to speak with an advisor or visit them in person at 2600 8th Street East. Okay, now that we have that out of the way, today I'm going to introduce a very special guest we have with us that I'm quite looking forward to the discussion with. So with us virtually, we have Dr. Shela Hirani. Dr. Shela Hirani is an associate professor at the University of Regina, specializing in neonatal and child health nursing. She earned her PhD in nursing in 2019 from the University of Alberta. Driven by her passion for improving the lives of marginalized women and children, she has received prestigious awards and recognition for her community services, advocacy for pluralistic societies, and her research efforts. Her commitment to breastfeeding advocacy spans diverse care settings with a focus on supporting vulnerable populations such as refugees, immigrants, internally displaced, and the homeless. She actively works to create safe spaces, removing breastfeeding barriers in public areas. Dr. Hirani's program of research, titled Breastfeeding Advocacy Research, Program, Practices, and Policies, aims to enhance breastfeeding rates, particularly among Indigenous, refugee, immigrant, homeless, and disaster-affected women in Canada. She is dedicated to promoting health equity, improving health systems, and fostering the implementation of baby-friendly initiatives in healthcare settings. Dr. Hirani's advocacy has not only advanced knowledge, but has also improved the well-being of breastfeeding mothers and their children in Canada and beyond. That's all very incredible, Dr. Hirani. I'm quite excited to get into it. So welcome to the Global Voice. Thank you for being here today.
Thank you, Mackenzie. Thanks for having me here, and it's my great pleasure to join your show today.
Of course, thank you. I was just telling Shela, I don't know how she even had time for this interview today, with how busy she is and all the work and advocacy efforts that she partakes in daily. So let's just jump right into it. So, as an immigrant yourself, could you share some personal experiences or challenges you faced when you first arrived in Canada, and how they influence your approach to working with immigrant populations today?
Oh, definitely. So I first came to Canada being a student, and I was doing my PhD in nursing from University of Alberta. I was in a different province at that time, and I did see the value of diversity because in my classroom setting, I had like so much of the diversity. I had class fellows from so many other parts of the world, and I was new to Canada, and there were various people who were like First Nation students, and there were people who were like immigrant themselves, or like they were living in Canada, or being a domestic student. They had so much experience. They were knowing city, and we shared a lot, like all the time. Like I was so excited to share my experience from my home country with them, and it was vice versa to learn about the new culture, new things, and what to do in the city. And that really excited me, and that really helped me to think of Canada as my home country, as my second homeland, I would say, because like during my PhD, I had whole 4 years, and I saw that everything in a way is a different kind of mechanism in terms of the transportation, the new culture, and there were various events where I attended. There were culturally um, kind of the events and that were planned by City of Edmonton at that time. And when I attended those, I really felt that oh, I'm in a country where the diversity is really valued so highly. I have such a great classmates and my teachers and everybody at the university were really valuing inclusivity. And like the other parts of like city where some of the places where I was aware of that there are immigrants who are new to Canada, many of them actually don't know language, and that's the reason they are unable to communicate. They have lots and lots of things to share, but unfortunately they don't have that skills, or like they don't have that social avenue or networking with other people so that they can just have that experience avail at their level of like at the exceptional level as I was doing. So I really felt that I should be doing something for those newcomers who are new to Canada and really are going through a new kind of a transition, and to what extent they have a kind of a language skills, or what are the other social support needs with them that are really making them to fully integrate into the society. And I really like valued the role of public libraries at that time. I'm a mom myself, so with my kid I used to visit the public library, and I did see that it was really offering so many services, and many immigrants and refugees coming to Canada at that time were not fully aware of those kind of the services. And that's where like I started to think of diving into this area. And before like traveling to Canada, like I have experience of working with disaster relief agencies and traveling to the active disasters where like thousands of families were displaced and migrated to a new place where their culture was different, and they were in a new place where entirely there was a new language, new kind of clothing, new kind of way of meeting and greeting, and they were also facing the challenges. So, with all my personal experience and what I observed during my professional life as a nursing professional, it was so much to have a kind of a new kind of agenda to work for people who are new to a country and have migrated to a new place.
Wow. Wow. Yeah. So you saw it firsthand when your work before and then decided to continue that work in Canada, right? That's
Definitely.
incredible. So your dedication to health equity extends to the support, as we said, of vulnerable women and children who are those displaced individuals, refugees, immigrants. So what kind of unique healthcare needs do you see within these communities? And then how do you try to address them through your research and advocacy?
Yeah, so what happens that whenever refugee or immigrant comes to the new country, not only the language skill like is an issue, but most of the time they are not very well aware of the services, and for them like there are many other systemic barriers, like many of them are not having the transportation or driving license in a new country in the very first go. Getting the job is quite difficult, and whatever the education they had in their home country, getting them accredited in a new country is again another layer of challenge and really takes so much of the time. So even I have like witnessed families in the healthcare settings who were not very well aware of like what are the social kind of the services available in the community that they can reach out to, and there were many of those challenges that they were facing, especially with regard to the accessibility of the healthcare settings because of lack of transportation and definitely their language skills. So that was like the first layer of the challenge that I noticed. And when I moved to Saskatchewan after my PhD in nursing from University of Alberta and started to work with University of Regina as an associate professor, I decided to have my program of research to be inclined to those families who are migrated to Canada or in Saskatchewan. And in Saskatchewan, we have like a large number of families that are migrating with young kids. So my area was breastfeeding, and I'm so aware of that breastfeeding often is considered as a taboo in many culture, and not every like women from different culture is so much comfortable to speak about their breastfeeding challenges and the internal problems that they are facing. And some of those mini problems turn out to be very complex ones. At times, if they are not sharing those with anybody or seeking the healthcare support or counseling facilities, and many of the mothers I'm aware of that they were not having the adequate language skills to communicate. And my research program like definitely is on the breastfeeding advocacy, and but like having it tilted to the new route of um, focusing on those mothers and families who are with the young kids really add a value to this program, because through my research that was funded by Saskatchewan Health Research Foundation, Shirk, and Jim Pattison Children's Hospital Foundation really opened a kind of an avenue to identify the range of barriers. So previously, like in literature, we were getting to know that language is an issue and transportation is a concern. But my research really unveiled a kind of a add-on challenges that were more of like depending on the layers of environment where women are actually in. So at times, like literature were saying that women are shy and not sharing their breastfeeding challenges openly, and that's why they are unable to utilize the breastfeeding services. But few other layer of challenges that I came across in my study were that there were so much of the racism that new immigrants, newcomers, and refugees face in our healthcare system, and it's so unfortunate because in their interviews, many women really cried and mentioned that how bad they felt while being in a healthcare settings where they really communicated something, but because of their accent or pronunciation, they were just like viewed in a different way, or like they were corrected, or they were not listened very attentively because they were not looking the same, they were not white skinned, and they were not like born and raised in Canada. And that really add on like so much of the another layer of interventions that we really want to incorporate in our own healthcare settings. And even mothers specified that whenever they delivered the baby in the healthcare settings, many times they were not having very highly qualified staff who were having the adequate knowledge on breastfeeding. So breastfeeding itself is a very, very specialized area. And the another gap that we identified in this research was that definitely we need more maternal and child healthcare professional in our province who have the like sound knowledge on guiding the women who are with multiple challenges surrounding breastfeeding. Many women shared that they had a kind of a request on culturally appropriate meals, or like there were some religious or cultural restrictions, but those were not taken care of. And while they were hospitalized, they were offered food that were not in accordance to their religious and cultural background, or that were like strictly prohibited. So just like for halal food and kosher food, if that was something their preference that was not taken care of, and they were off pork at that time when they were hospitalized, and no further support were provided. There were women who went hungry after giving birth to their babies, and they were unable to breastfeed because they were not having adequate nutrition for themselves while being in hospital. So
Wow.
that was another layer of challenge that was very, very surprising. Few moms mentioned that the meal portion that postnatal women receive in hospitals are very, very small size portion, which is not meeting the adequate needs of a mother who is actually a lactating mom and have to take care of her own recovery while giving the breastfeeding to the baby. So that was another kind of the challenge that we came across, and we came to know, and this was really a great, great surprise.
Mm-hmm.
And adding to that, like I would say that World Health Organization have really made aware everybody that formula is not a right option for the babies. And we know that formula milk is a kind of artificial product. Often they say that it's a breast milk substitute, but breast milk is always superior because breast milk has very natural antibodies that, and the nutrition that fulfills the need of the babies. And that is very, very essential for the brain development, for the growth, for the gut health, for the metabolism, and for overall health and well-being. And on the other hand, like formula milk is the dried up cow's milk, which is not actually very much suitable for the child's gut health. So whatever is being fed to the baby, the absorption and all those things at times end up baby into the variety of diseases, and then they are not assuring a good antibody presence in it because that's ideally not possible. And whatever the nutrients are there, they are all like not as similar as we have in the breast milk. But in the healthcare settings, I came to know that our doctors and in healthcare settings, moms are often offered the formula milk samples. And many times, immigrant mothers and newcomers tell that if they were offered the formula, they thought that maybe this is the best option. That's why here in Canada, we are being offered this sample. So those moms who were previously breastfeeding, they stopped breastfeeding and they started to give their babies the formula. And that also increased their economic burden because they were already
Right.
looking for jobs, they had very few savings available, and they were utilizing on purchase of the formula milk, which is extremely expensive and was adding to their overall bills and cost of living. So that was also not an ideal thing. And another pointer that we came across was also on the gender sensitive care, apart from the culturally sensitive care. Many moms were more comfortable in having the obstetrician and gynecologists and lactation consultants who are female. So they put a request for a female physician, but unfortunately, whenever at the time of delivery, they were getting male physicians. So their whatever their concerns were, they were not able to clearly communicate. And one of the moms shared that I had a sore nipple, and I had to share it with the physician who was a male physician, but I couldn't share it because, on the other hand, I had to even show it to him. And in my culture, it's something not considered a very kind of respectful attitude of a woman to show her breast or body parts to a male physician either. So that was another layer of the challenge that women were facing in seeking the breastfeeding support. If like all those accommodations are not taken care of, so these were like the key highlights in the research that I am doing, and I completed few of those projects in past, and I have few more with regard to the housing and parenting that are currently in progress.
Well, let's jump into that. I wanted to know about some of your other current projects with the refugee and immigrant families. Um, and then I know that you did a recent study, so we're curious about what are some of the housing challenges in addition to all these other challenges that you've mentioned, which is are so vast. And I work with immigrants, refugees every day, and there's so many challenges. And now I'm just hearing about, yeah, I never thought about like accessing healthcare is one challenge, but then all of those other layers, there's just so many layers to this. So then, yeah, there was some more housing challenges you mentioned. So that were encountered by the refugee and immigrant families that also affect their health. So can you talk about that? And then what were some of the proposed recommendations from that study?
Yeah, definitely. So this was my SHIRK funded, it's a tri-agency, governmental funded SHIRK agency that funded my housing project. And we undertook this project in collaboration with the community partners. ACRN was the key one who was the main partner in this research. And I would say that specifically in here, like we identified the layers of challenges with regard to the housing. So, as I talked about racism in healthcare settings, but unfortunately, like newcomers, immigrants, and refugees also face the racism from the realtors, from the mortgage broker, from the financial advisors. And whenever they are going there for their mortgage approval or for seeking loans, they really face a lot. And many times, like the statements that they face, that oh, you don't belong here, you have a sin number starting from this thing, you are still new to Canada, you don't have the credit history, or you are like you are not like born here, or like there is, we can't rely on you, we can't trust you. And these are some of those kind of the statements that they often like face. And many of the immigrant and refugee and newcomers who we interviewed were actually living in the rental apartments that were far from city, far from grocery stores and the hospitals, and the schools were even far located, and they were not in the nearby school zone for their kids. So all the time they were facing the challenge, especially in the cold weather, where there wasn't any school bus either available, because of a specific kind of a zone they were allocated, or in the distance from the school. So they had to have their own transportation, and if they were relying on public transportation, and they had the children of different age groups, and they have to have been in the different school, like one is in the high school, one in the elementary one, other has to be dropped in daycare. So that was kind of a troublesome without adequate transportation. And many of them were living far from cities because the rents were more affordable in that areas. But those areas where they are living most of the time are not safe. There are more criminal activities. At times drug dealings are also happening in those kind of the residential areas, where like they are living with their own kids and the family. And many of them mentioned that the the landlord at times have a like a kind of different attitude. They at times just they also face the racism from their landlords. And at times they say, we are increasing the rent. If you want to live here, live. Otherwise, you may leave anytime. There are massive renovations that are required in those suites where they are living. They stated that there are bed bugs in there, there are cockroaches, there are other infestations. And whenever they communicate these needs to their landlords, they say that I can't help. You have to handle it by yourself. At times, like they were with a big family size. So whenever like the refugee and immigrants, they have more, at times, like at times they have 5 to 6 children of different age groups. And at times they were living in a 2 bedroom apartment. And they even spoke about that some of they were their kids were living in closet. And that was something that I really felt so bad, that they don't have adequate ventilation in their space, they don't have the facilities. Apart from that, there are space constraints as well. Many of them were able to secure housing through Regina and Saskatoon Housing Authority, but like it took so much of the time to qualify for that particular housing program. And specifically they were asked to provide all the details, and many times based on their family size they were not getting the housing that they were looking for. So at times, like the small units to the large family size was something not feasible for many families. Many families were living in the places and in the suites where there wasn't any ventilation at all. So, and if there was a member in the family, since like many newcomer live in the multi-generational families, so at times they had the elderly people with them, they had people with disabilities, and the way they were getting the suites, they were not actually very much disability friendly, in terms of there wasn't any pavement or any such kind of accommodation in those suites that they were getting in the affordable rent. So the key recommendations that they had from this project was that they really wanted to be involved and treated with a kind of a respect by multiple stakeholders. They
Mm-hmm.
really wanted that whenever the housing decisions or policy or programs are made, they should be involved as a patient partner so that they can voice out that what exactly their needs are.
Mm-hmm.
And many times it's not that government is not allocating funds. Definitely government is allocating the fund to authorities and at times to the realtors. But in between, when it comes to the allocation, there are some kind of like biasness somehow that are introduced, and then somehow they don't get what exactly they are they have requested for. So they really looked for more better involvement, and they looked for more kind of a benefits for the kids.
Mm-hmm.
So, and more kind of the affordable housing, especially during the time when they are new to Canada, still looking for their licensures to be accredited, or like getting the job, learning the language, and meanwhile, if they get some kind of a more additional support, so that their kids at least don't face any kind of the physical and mental issues
Right.
because of all that kind of the overcrowding in the household and the other issues in terms of the renovation, and the
Mm-hmm.
second is because of the accessibility.
Right. So it's clear that it's all connected. Is all connected to health related issues as well because yeah, like you said, there's the mental stress that comes with that, the not adequate ventilation and so on. It's a very interconnected issue. Thank you for sharing. We're just going to take a short break and then we still have another half to talk with Dr. Shela Hirani. So thanks for staying with us and we'll be right back. Okay, so Dr. Hirani has received numerous awards, some of which I'm going to list off. So, you've received the Queen Elizabeth Platinum Jubilee Medal from the Government of Saskatchewan. You are recognized by the World Health Organization as one of 100 outstanding women nurses in 2020. It's incredible. In 2022, you received the Multicultural Leadership Award, as well as the YWCA Nutrient Women of Distinction Award, recognizing your community services, advocacy, work, and research and scientific pursuit to improve the quality of life of vulnerable populations, which you've been discussing. Those are all incredible, incredible achievements. So, how do these honors impact your ongoing work in advocacy and the research that you do, as well as just what does it mean to you overall to be recognized in such big ways?
Yeah, so these awards are such a great honor for me, and I consider these recognition more as a responsibility, apart from the recognition, because a responsibility to further advocate and continue with my advocacy movement for the vulnerable population, those who are in need, for the breastfeeding mom who are really needing so much of the support with the young kids. So I just take this new kind of a journey, new endeavor to be more inclined to the continuation of my community services with all those people who have been like in need and really require more of the advocacy and support from their social environment. And it's my great pleasure that being a healthcare professional and being a lactation consultant. And I'm also in a researcher mode, and I'm also an academician. So I hold those roles where I would say that I'm privileged, where I'm in the helping situation to advocate and voice out and disseminate all my research work and practice related concerns and bridge a kind of a theory practice gap. So these recognitions are kind of, I would say, that have really boosted my confidence further, that whatever I'm doing is really going in the right direction. The impact from that are like making difference in the lives of many, and I'm so happy to see that impact. And with that, I'm really very much motivated and would like to continue with all my journey that I have been doing.
Oh, that's very nice to hear. So, as we know, the COVID-19 pandemic had a profound impact on healthcare. So how was your work? How has your work adapted to address the unique challenges faced by the vulnerable populations, including those affected by disaster and displacement during the time of COVID?
Yeah, so pandemic and COVID time, like the different waves of COVID themselves, like pose various challenges to families, like especially to the vulnerable and marginalized families in Canada and even outside Canada. And during the time of COVID, what I noticed that many women actually who gave birth to the young babies and they were in the hospital at that time actually caught COVID at that time. And everything was so new that mothers who were infected and they were not knowing that whether they should still breastfeed the baby or they should stop breastfeeding the baby with a fear that they want to pass on the infection to the newborn, which not be an ideal kind of a scenario. And at that time, there were no vaccines for even the adults and even for the newborns. They were like are considered so much immunocompromised because they don't have their immunity very much built in the first few days of the life. It really takes up to a year. And once they get fully vaccinated, and COVID was everything a kind of a new journey. Many healthcare settings were not accommodating many patients in the ER, especially when mothers were going to ER with the breast engorgement or nipple crack sore or kind of other breastfeeding related concerns because all the clinics were shut down. The family doctors were not attending the patients in person, and breastfeeding moms, since they were not having anybody face to face and they couldn't show it the concern because they at times have to show the breastfeeding position to the practitioner to make sure that they are really having that breastfeeding done in a right position. So that was a kind of a various layers of challenges that came into account all of a sudden, not only to the newcomers, but all the mothers in general who were breastfeeding at that time or who delivered the baby and were thinking to feed the best kind of a nutrition to their babies. So at that time, when the WHO took a kind of a turn that every mothers can breastfeed, so when they released some kind of the positional documents, they were so much in the technical languages that people, not everybody can read and understand it so well because they just released the position statement and they circulated it via web and not everybody like that have access to the websites and they can't interpret it all those kind of those technical languages. So during the initial wave of COVID, what I realized that breastfeeding mothers really need a kind of a concrete, simple, and easy to understand kind of an information that what they should do and whether it is safe to breastfeed the baby and how they should proceed with it in case if they are affected by COVID or they are COVID positive, because WHO actually recommended that mothers should breastfeed the baby. And if they are positive, then they should practice the very good masking, hand washing. Their clothes should be very much clean. They should not cough on baby, and they should just either express the milk and feed the baby or directly breastfeed the baby while having the mask on, and have a caregiver involved in the care who is healthy and not affected by COVID infection. And these were like few of those areas that I really felt the need to disseminate this knowledge to people in general and to general public to make them aware that this is still a safe option and risk of breastfeeding is like very lesser than getting an infection with COVID or feeding a formula to the young baby. So at that time, I developed e-resource, and from that, this was just a start. And I started my YouTube channel with the name Dr. Shela Hirani, and started a Facebook page on breastfeeding during COVID-19. And I started to develop the animated video from that time that what a mom should do and why to breastfeed during COVID-19 and how to breastfeed. And in case if mother is hospitalized or in ICU, what should be the alternate option for the other moms or like for that mom. So that was something that was disseminated widely through e-resource in an easy to understand language. And that was so much well received during the time of COVID that
Yeah.
many moms who were in the confusion what to do next, they were actually got the right information at the right time and they sustained their breastfeeding practices. And same thing we just had it with the other projects. Like I continued with my trend of developing the animated video from all of my projects so that we make the project findings available to the general public in a very easy to understand language. And then they can just view the project findings in 2 to 3 minutes and get what exactly is going on and what exactly could be done for the newcomers. So these were disseminated not only to the general public but to the key stakeholders, including healthcare professionals and whoever could be involved in the care or in providing the services to the mothers in general.
Wow. Yeah. So you were very busy during COVID.
And it was a great pleasure because when moms wrote their feedback, they were so positive because they said
Mm-hmm.
that they were somewhere like they were not able to go to the grocery stores. They were thinking that they're gonna go to grocery store, they're gonna buy the formula milk, and is it something that they should do? And they just or the breast milk or the better alternate is the express breast milk could be how they could store it and they can still feed the baby
Mm-hmm.
and many babies at that time were in the NICU as well and mothers were discharged from hospital after 2 days of their hospitalization soon after their childbirth but still like they were expressing their milk giving it to the hospitals nurses and they were feeding it to the baby and that really helps in the baby's recovery at that time because they were getting their own mom's milk.
Right. Yeah. Yeah, I was just thinking that, the confusion and it was scary going through COVID when no one knew what was going on. I couldn't imagine that added layer of also not having a good grasp on the language as well when everything's going on. So, the fact that you kind of boiled it down to really easy to understand language and just this is the key findings, this is it. Like that's incredible. Very, very useful. So, what advice would you give to healthcare professionals and researchers who are working with immigrant and vulnerable populations as it relates to promoting better health outcomes and access to care for these communities?
Yeah, so my key advice is that always involve them as a patient partners. So the patient partner are the one who are with the lived experiences and those at times like while being in the offices, like if you are making a policy for somebody who we are not very well aware of and we have not involved them in the development of that policy may not work. So like it's something we have to involve them whenever we
Mm-hmm.
design a program, whenever we design an intervention, whenever we design any policy, so that what we can understand better that what exactly they want and what exactly we should offer them. So maybe like they want ABC and we are offering them XYZ and that may not meet their needs. Apart from that, my other advice is that like everybody, every individual like have their own cultural background, religious background, social ties. So be mindful of their cultural background and make a kind of a judgment accordingly whenever you are making like any kind of the intervention workable for them, especially not only by involving them but also by respecting their cultural beliefs at
Mm-hmm.
times like if they want it in the certain way based on their religious beliefs or cultural beliefs the respect element and accommodation is very very important
Mm-hmm.
apart from that like demonstrating the cultural competence and cultural sensitivity is somewhere like I always would like to prepare my nursing students on and I often like emphasize in my lectures to the nurses and nursing students that this is something very very important but also like apart from nurses we also need the similar and consistent interventions by doctors as well
Mm-hmm.
and also from other healthcare providers and allied healthcare providers and people who are the service providers in different agencies. So we need the like the kind of same accommodation, same respectful attitude, same cultural competency, no matter they are realtor, they are in a financial institution, or they are in transportation, or in the library, or in a settlement organization, or in hospital or outside hospital, anywhere. Like valuing equity, diversity, and inclusion is something that we all should demonstrate either in our research, in our practice, or in our daily life dealings with everybody. So that would be something my key advice to everybody, because we are so blessed in Canada to have a multicultural society where we can learn a lot from each other and really cherish each other's celebrations and festivals and cultural food and so many things. Like diversity is something that gonna be really give our future generation a kind of a new route to understand the value of pluralism. So definitely when things are in action, then we are role modeling to our future generation the better ways to navigate to any such kind of the challenges that we might face or other might face. So all our actions are in a respectable mode for everybody.
That's beautiful. Really well put. Is there any last kind of things you want to mention, either about your research or anything you want to leave the viewers or listeners with? That was such beautiful advice. I'd love to hear more.
Yeah, so I would say that um, always like believe in yourself, no matter you are a newcomer, you are immigrant or refugee, or like a person who has been living here for many years. Like in whatever role you are, try to be an advocate. Advocate for yourself and advocate for the others. And when we are giving a helping hand to others, then we are helping ourselves and others. And that's what like I really would like to see that positive change coming in all the type of the layers of environment that are affecting our health and well-being. So be an advocate and be a role model and believe in yourself, and just extend all your friendship to your neighbors, to the society at large, and to make this world a kind of a very, very positive place that people really give an example of the community that we are sharing here in Saskatchewan and in Canada, that this is something gonna be the lifelong example for the people who are doing the global work and national and international kind of the work anywhere.
Thank you. We'll leave on that note because that was great. Thank you, Dr. Shela Hirani. This has been a lovely and very enlightening conversation. I've learned a lot. I know our viewers will appreciate as well. So thank you so much for taking the time to be with us today. And thank you for all the work that you do. It's clear that you've impacted so many lives in very positive and beautiful ways. And I'll certainly take your advice, and I hope others do too. So
Thank you so much. Thank you.
yes. You've been listening to The Global Voice. My name is Mackenzie, and we'll see you next week for another episode.